The real question in helping someone is what is causing the drain or the suck of energy from their system. And so we are going to evaluate a number of factors when we're working with a person, especially in their initial exam. And we're going to be checking energy points related to the emotions and to the sensory lobes of the brain, the processing of sensation, and to the cranial nerves, and to the motor areas that are controlling the muscles, and to the organs, and to the inflammation reflex points. And we're going to look how high the energy is on those points and determine where do we need to be working the most. Do we need to work with emotional traumas the most? Or do we need to reboot the cranial nerves, which are so powerful for our nervous system, the nerves that come off the brain stem and regulate the face and the head and the neck? Or do we need to be working with the motor pathways that control the muscles? Is there a big drag there? Or do we need to be working with the organs and tie in the nerve supply so that the organs get better nerve supply? And do we need to be supporting these organs nutritionally? And do we need to be finding inflammation markers in terms of infections, viruses, bacteria, parasites? Or do we need to be working with food sensitivities? Or do we need to work with environmental allergens like mold and dust? Do we need to be working with toxins like pesticides and plastics? Do we need to be working with heavy metals like mercury, lead, arsenic, aluminum, nickel? So those are a number of factors that we're going to evaluate when we first see a person and periodically, so that we can weave our way into the exact areas where we can get the most change. And often it's not where we think it is based on our symptoms. So I just checked a person this week who I've worked with some over the years, but has a flare-up of certain symptoms, sensory symptoms in their feet and at their chest and so on. But the biggest 2 points that showed up for them related to inflammation, and then it related to mercury, and then that totally touching the amalgam filling where the mercury is leaking into their system, totally changed the energy around the sensory lobe of the brain. And so we know that that mercury trigger is a big thing for them, and we want them to get out their amalgam filling, the mercury containing filling, safely. So we're going to look at a lot of factors like that, and we can use labs for various analysis also. We're going to look at the hormonal system, the immune system, the detox pathways, and the neurological connections. And that's our HIDN model, which is a trademark model that we have. So the real question is, where is the drag on the system? Where is the suck of energy? What's holding the person back? Where's the weight, so to speak? And when we can find those factors and work with them, amazing things happen. So what I'm particularly saying is, just because I'll soon be a master practitioner of quantum neural reset therapy, which releases emotional trauma out of the brain, doesn't mean I'm going to do that with every single person, or that that's going to be the biggest win for every single person, but it's a big win for a lot of people. Or just because I'll be certified in quantum neurology doesn't mean that I'm automatically going to, put a lot of emphasis on cranial nerves for some people, or the motor connections or the sensory connections. So we want to find out what, based on all of our experience of 35 years in this natural healthcare field, and all the neurology training and the functional healthcare training and lab work and so forth, when we put all that together, how can we determine the best place to start with a person and the place that's going to get us the most change? And so if you've been having a chronic health problem and you've really had trouble finding where to start, and maybe you've tried a few different things and some docs have worked on different things, but they haven't hit the nail on the head, I would just invite you to get an exam in our office and help us see if we can hit the nail on the head by finding these hidden factors that may be causing you disturbance. And we do that in a number of different ways, both through reflex points and through very specific targeted labs, so that we can find out what's the hidden factor for your health to turn around. And we're seeing amazing changes with people and getting amazing referrals as a result of that, and I look forward to helping you. I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined. Subscribe to us here on YouTube, like us on Facebook. If you have an autoimmune condition, be sure and get in our autoimmune group called Drugless Support for Autoimmunity. You can go to our Winters Wellness Center page, hit groups, and you'll see it there. I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined.